Πανοσολιότατε εκπρόσωπε του Αρχιεπισκόπου Αθηνών Πρωτοσύγγελε, υψηλοτάτη, εξοχότατε πρίτανη του Διπλωματικού Σώματος και πρέσβης της Κυπριακής Δημοκρατίας, κύριε Βουλευτά, κύριε Υπουργέ, κύριε εξοχότατες κυρίες, εξοχότατοι κύριοι πρέσβεις, κύριε Πρόεδρε του Ελληνικού Ερυθρού Σταυρού, εκλεκτοί μας προσκεκλημένοι, καλησπέρα σας. Είναι μεγάλη μας τιμή που παραβρίσκεστε στη σημερινή εκδήλωση για τον γιορτασμό των 20 χρονών του Ιδρύματος Καλαγκός. Για την παρουσίαση του έργου του Ιδρύματος, επιτρέψτε μου να προχωρήσω στην αγγλική γλώσσα, ώστε να γίνει αντιληπτή από το σύνολο των προσκεκλημένων, λόγω της παρουσίας πρέσβεων και εκπροσώπων από διάφορες χώρες, στις οποίες το Ίδρυμα δραστηριοποιείται τα τελευταία 20 χρόνια. The Royal Highnesses, Your Excellencies, distinguished guests. It is really wonderful to see all of you here for the celebration of the 20th anniversary of Kalangos Foundation. In fact, over this past 20 years, the foundation has served life by getting as main targets to provide access to cardiac health care for children suffering from heart diseases in low and middle income countries, and to provide training facilities to health professionals of these countries. By achieving these two missions, the foundation contributed also to the sustainable development in cardiac health care. The foundation was recognized by Switzerland as a public utility, and in 2015, the Humanitarian Association Cœur pour Tous, which was founded in 1998, was incorporated into Kalangos Foundation. Now you will ask me, why do we try to provide access to cardiac health care for children of low and middle income countries? To answer this question, I have to present you the three parameters to determine the needs in cardiac surgery for a precise country. These three parameters, the first one is the number of open heart surgery cases per million of inhabitants per year. The second one is the number of cardiac centers per million of inhabitants. And the third one is the number of cardiac surgeons per 100,000 inhabitants. Regarding the first parameter, the needs in terms of open heart surgery, to cover the needs in terms of open heart surgery, the health system of a country should be able to perform 860 cases per million inhabitants per year. As you see here, in America, you have the highest number, 1,222 cases, surgeries per million inhabitants per year. In Australia, around 800, in Europe, around 600, and then there is, unfortunately, the low performances. South America with 147 cases, Russia 37, Asia 25, and unfortunately, the worst one is Africa with 18 surgeries per million inhabitants per year. Regarding the second parameter, the needs in terms of cardiac centers, again, the highest performance is in United States with one center per 120,000 inhabitants. In Europe and Australia, we have one center per 1 million inhabitants. In Asia and Africa, again, you know the worst scores. One center per 16 million inhabitants in Asia, and in Africa, one center per 33 million inhabitants. It means 4.5 billion of people have no access to cardiac surgery outside of North America, Europe, and Australia. Now, the last parameter is the number of cardiac surgeons per 100,000 population worldwide. Again, the highest score belongs to United States with 51 cardiac surgeons per 100,000 inhabitants. And then we go to Germany, 13 cardiac surgeons, China 10, Latin America 7, Egypt 6, Sudan 0.6, and Tanzania 0.3. And I can tell you that many African countries has simply, they don't have cardiac surgeons. Regarding the congenital malformations in low and middle income countries, we know very well that there is between 6 and 18 million children suffering from congenital heart diseases. The incidence of congenital heart diseases is between 4 and 12 per 1,000 births alive. We know that there is every year in the world 130 million births. And with this incidence, it means that to this total number every year, there will be between 0.5 and 1.5 million neonates who will be added to this total number. Regarding the rheumatic valve disease, which this one is the second pathology affecting the pediatric population in low-income countries. According to the World Health Organization, we know very well the incidence is 0.6 per 1,000 children. And as you see here, in Africa, this incidence, it goes up to 1.4 per 1,000 children. It means that 1% of children living in developing countries suffer from this disease. Again, according to the statistics of 2019 of the World Health Organization, at least there is 12 million people involved in this disease. There is 2 million children who need repeat hospitalization, and every year there is 500,000 deaths per year, and the majority, unfortunately, they are children. It means there is 1 million people, especially children, who need valve surgery. To give you a better idea, a more precise idea, consider a country with 10 million population, like Cambodia, Senegal. Vietnam is 100, Mozambique is 20 million. In a country with 10 million inhabitants, there is 20,000 children waiting for surgery with congenital malformations, and there is 5,000 children, again, waiting for surgery and suffering from rheumatic valve disease. It means totally, in a country with 10 million inhabitants, there is 25,000 children who need cardiac surgery. In Vietnam, imagine you have to multiply with 10, there is 250,000 children. And in Mozambique is 50,000 children. Now, what is the tactical plan and the interaction of the foundation to set up a humanitarian project? The foundation is here, the host country, and especially we are dealing with the health authorities of these countries around the project. Usually, Kalangos Foundation is providing a lot of education and teaching, financial support, but here, I put that the purely altruistic approaches are short-term. It means we are not here to give endless money and ask them to set up programs to develop cardiac surgery, if really the target is not education and teaching. And then, on the other hand, we also provide administrative and logistical support, clinical and research support. But on the other hand, we have also some expectations from the health authorities of the host country, and especially some financial support, because when you set up a cardiac center, they are supposed to pay the salaries of the local medical and paramedical staff. And we expect also for the viability, for the long-term viability of the project, we expect also a lot of political support. My first steps in humanitarian medicine started in '93 when I started being involved in the humanitarian program of the Swiss NGO Terre des Hommes, and we started referring, especially from African countries, a lot of children to the University Hospital of Geneva. And in '98, the Swiss Cooperation asked me to go and do a screening in Eritrea. After 30 years of war against Ethiopia, the situation really was a disaster, I can tell you. And I decided to organize my first humanitarian mission in Eritrea, in Asmara, in the capital city. As you see here, we brought an old echocardiography machine. With the cardiologists, we started doing the screening. I can tell you, perhaps we checked more than 500 patients during this 10 days humanitarian mission. And then there was only one general hospital for all the country in Asmara, the Hospital Halibet, and with my team, we operated 20 cases and mainly children. This one is the first case which was operated on successfully, and then the president of Eritrea and the Minister of Health came us to visit because it was, something very spectacular in the conditions under which his population was living. And then in '98, we set up a center in Georgia, in Tbilisi, in the Eristavi Hospital, especially after the kind invitation of the former president of Georgia, Eduardo Shevardnadze. And really, I spent a lot of years in Tbilisi, a wonderful country, Georgia. And here you see the first case I operated. This one is the entrance of the Eristavi Hospital in Tbilisi. And here you see my team, as well as the local team of the Georgian hospital. In '99, then we decided to set up a cardiac center in Maputo, in the capital city of Mozambique. And this one, it was the former Prime Minister Makumbo, who graduated from the medical school of Lausanne, physician, invited me to check a little bit the conditions. And then I had the privilege to meet the president of Mozambique, Chissano, who gave us the half of a military hospital from the Portuguese colonial period. And then we converted this hospital into a pediatric heart center, and we operated a lot of cases because I had a lot of regular missions. And here, the first case I operated, as you see, the intensive care unit, my nurses were doing, the rehabilitation just after surgery. They were helping the children to be mobilized. And then in 2000, we set up a pediatric heart center in Mauritius, and this one for the whole Indian Ocean, Madagascar, Comoro Islands, Seychelles Islands. And this center is still functional, and they operate on all the children suffering from congenital heart diseases for the whole Indian Ocean. For this reason, the president of Mauritius conferred upon me the officer distinction of Mauritius and of the British Empire. In 2003, my brother country, Serbia, Belgrade, thanks to the commitment and contribution of the royal couple, we reinforce the congenital heart surgery. And especially in this photo, do you remember the little girl, Diana, Your Highness? Because I was in the United States, this girl was dying because half of her heart was destroyed by an infectious process, abscess perforation. Really, it was a matter of hours. And I took the plane, I stopped in Brussels, I took 2 human valves, I continued to Belgrade. I remember directly from the airport at midnight, I was in the hospital, and we operated on successfully this little girl, Diana. Thank you again. I know your commitment, Your Highness. In 2003, we started reinforcing the congenital heart surgery at the University Hospital of Ho Chi Minh. Ho Chi Minh is Saigon. And we signed a memorandum of understanding between the University Hospital of Geneva and the Medical Sciences University of Ho Chi Minh. And here you see the intensive care unit, the operating theater. Here I had a lot of meetings with the Minister of Health of Vietnam, really a wonderful lady who helped me a lot to develop this program, as well as the rector of the University of Saigon. And then 2007, we started helping India, especially Bangalore, Raipur, Chennai, especially with the successor of Sai Baba. And recently, with Natalia, we did a humanitarian mission. We operated many children. You see here the photo of the local staff. And here with the successor of Sai Baba, Swami, we have a lot of projects, not only in India, because he has a very large vision, and probably we will try to set up in many of these developing countries a lot of pediatric heart surgery centers. In 2016, I was involved in an educational program in China, Yinshuan, at Carver Heart Center. Here you see my team. We operated a lot of children. And especially, we train the local staff, and really I am proud of them because they are fast learners, and they appreciated this contribution a lot. Now you see here the countries where Kalangos Foundation had and continues to have humanitarian activities. We started with Eritrea. The second country was Georgia, Mozambique, Mauritius, Madagascar, Comoro Islands, Lebanon, Serbia, Vietnam, Morocco, Cyprus, India, Egypt, Syria, Nigeria, Algeria, Albania, Moldova, Azerbaijan, Kyrgyzstan, China, Belarus, Cameroon, Ukraine, Poland, Turkey, and Greece. And over this past 20 years, we did countless humanitarian medical missions. And we set up a lot of cardiac healthcare projects in these 25 countries. We created 5 heart centers in Mauritius, Mozambique, Comoro Islands, Lebanon, and Cameroon. We operated on more than 18,000 children since '98, especially by the heart teams trained by us in all these countries where we were involved. And thanks also to the scholarships of the foundation, we trained more than 100 health professionals. And really, you see the positive impact when you train, when you educate. This one has a big impact on the sustainable development of cardiac health care of the low or middle income country. Here I put some photos of the cardiac surgeons we train in Geneva as well as in Paris. And then I have also to pay tribute to some people who are really very important for me. And Mrs. Vicky Bafataki expressed everything regarding my father because he was a great philanthropist. Really, I was a child, and in the garden of the house, there was a lot of patients, poor patients, waiting for consultation. And not only for consultation, and then sometimes, I was seeing my father running after them to give all his money from his pocket to help them, because he was telling me, only a prescription is not enough. You have also to provide the financial support to allow them to buy their medicines. And for this reason, the municipality of Istanbul, it was done first time, the name of a Greek was given to a street in Istanbul. And here you see the mayor of Istanbul, with me, putting, the plaque on the street. And then I would like to pay tribute to a wonderful politician, wonderful man, especially very committed to the humanitarian medicine, the state councillor of Geneva. He was a state councillor between 1989 and 2001, Mr. Guy-Olivier Segon, who allowed me to refer a lot of poor cases from African countries to Geneva and to operate them by covering all these cases financially from the funds of the State Council. And especially when I created the humanitarian association, Cœur pour tous, he gave us the first financial support contribution, which allowed us to develop our humanitarian actions and to arrive to this level. Thank you, Mr. Guy-Olivier Segon. And then the Royal Highnesses, because I am always impressed by their humanitarian commitment and contribution. You are doing a lot of things for Serbia, really. And everybody has to know this one. And then I would like to pay tribute to the former Vice President of the United States of America, Mr. Al Gore, who allowed me to set up an educational program for South Asia countries by mobilizing a lot of funds from the Clinton funds. Really wonderful man, very well known, especially in the ecological issues, but really deeply also committed to this kind of humanitarian actions. And then I would like to pay tribute also to Mr. Bernard Kouchner, the former Minister of Health and Foreign Affairs of France, the founder of Médecins Sans Frontières. They got the Nobel Prize, and he helped me especially a lot to develop projects, humanitarian projects in African countries, because to develop a project in an African country it's not easy. You have, to establish some political interactions, and really he was a very skillful diplomat, and for that reason he was also the former Minister of Foreign Affairs of France. And again, thank you to Mr. Bernard Kouchner. And then here I have my team of Cœur pour tous, hélas. We funded this local humanitarian association in 2015, and more than 200 children with no social coverage were operated on, thanks to the commitment and contribution of Madame Andrea Petrulaki. Thank you, Joanna. Madame Rodopoulou, Dr. Petropoulos, Mr. Areteos Evangelos, Madame Theodoropoulou, and Madame Stamatopoulou, here present. And then in 2003, I started collaborating with all international organizations based in Geneva, and I had the idea to launch the global forums on humanitarian medicine in cardiology and cardiac surgery. And every 2 years, we continue to organize those global forums. The last one was held here in Athens between 11 and 13 of November 2021. And the next meeting will be again in Athens between 16 and 18th of November. And then we launched also the Journal of Humanitarian Cardiovascular Medicine in 2015 because I wanted also to dedicate a journal especially for low and middle income countries and try to report the clinical, epidemiologic, public health, and basic research studies focused on cardiovascular medicine. For this journal, my right hand is here. She contributed also for the organization of this event. Madame Fotini Kirici, thank you so much. And now we are committed to serve life endlessly. And for this reason, we need a vision. And now what is the next plans is to construct an international humanitarian city in Silivri in Istanbul in collaboration with the Greek hospital of Balukli. We have 141 hectares, and it will be the first international humanitarian city in the world. And as you see, we have all the architectural plans here. This one we will start with the hospital, pediatric hospital, and everything will be free of charge for poor children. Why Istanbul? Because with Turkish Airlines, one flight from African, Asian countries, and you are in Istanbul, and the center will be not far away from the new airport, 30 minutes. And why, the collaboration with the Greek hospital? Because the Greek hospital is a big hospital in Istanbul, and this hospital has all the licenses to make this humanitarian city functional. And then the second project is the creation of the European Institution of Humanitarian Medicine, because we need an institution in order to coordinate all the humanitarian activities, all the humanitarian medical activities in Europe, especially in the European Union. And then, again, with Madame Kirici, we are trying to set up the Balkan Society of Pediatric Cardiology and Cardiovascular Surgery. We sent all these invitations. There is a big interest coming out from the pediatric cardiologists and pediatric heart surgeons of these countries. I believe within the next few months, again with the contribution also of the Hellenic Society for Pediatric Cardiology, we will be able to launch also this Balkan Society and organize the first scientific meeting here in Athens. In conclusion, over the past 20 years, Kalangos Foundation was the voice and savior of some of these voiceless 16 million children who are expecting the help of all of us for a healthy life with human dignity. Thank you very much.